My name is Destiny Roxas, and I'm here today with Ari Vargas, an ICU nurse at Sharp Chula Vista.
Hey.
Hi. I met Ari through our mutual friend, Rachel Gonzalez. I've always had a huge respect for hardworking women, and she's a nurse out here on the front lines and also a mother. And I'm not sure if you know this, Ari, but every night at 8 p.m., downtown lights up to cheer on our healthcare workers just like you. And we really appreciate the sacrifices that you guys are making. I'm always there like blinking my little light and, just trying to support our healthcare workers. How have you been handling everything, and what have you been seeing with coronavirus?
This pandemic is obviously something unlike anything we've ever witnessed. Healthcare professionals, nurses, CNAs, RTs, doctors, everyone that's working in the hospital, I think they're really struggling with moral distress and compassion fatigue, burnout from, limited equipment, protective gear, heavy workloads. The virus is real, doesn't discriminate. How does it compare to the flu? Mm-hmm. And I think that obviously this virus has a significantly higher mortality rate than the flu. I work in the ICU, so I'll give you kind of an ICU visual of what a hospitalized patient and recovery would look like in a COVID patient. Typically, our patients in the ICU are intubated, life support. They're on a breathing machine, which is breathing for them, heavily sedated and paralyzed, just to improve mechanical breathing. And we have them in a prone position, which is laying on their belly, and they're all alone in a hospital room. We are not allowing guests or family members in the hospital at all.
The asymptomatic portion is the part that really kind of scares me. It's something where, you never know who you might negatively impact or, kill. So,
right.
Like with the inconsistent and sometimes inadequate testing in certain areas, is reopening businesses advisable from a medical perspective? I'm asking that primarily because, again, I feel like there's a lot of asymptomatic carriers that could potentially be out there that are not getting obviously tested and they don't know. And I know the incubation period tends to be pretty long, and you could be carrying it and then passing it off for quite some time and just not know. Considering I know the beaches just opened and that was a really big deal, a lot of the parks, and people are getting really antsy. But what do you kind of think of all of that happening? Do you think it's premature?
We all want life to resume. We all want businesses to open. We all want to go to a restaurant, go to a bar for drinks. Lord knows we need them. However, I think it's important to do it the right way to avoid a second surge. We can't simply return and reopen the country just because some specific areas haven't been hit as hard as others. In order, to do this the right way, we need to be patient. And I think just kind of doing it the right way the first time. Ultimately, I think, as a country, we'll dig out of this hole, but let's do it with as many saved lives as we can and do it the right way. I've also noticed that there's a lot more people wearing gloves and wearing masks, and it's in some cities it is mandatory. However, I think cross-contamination is concerning, and it's definitely occurring with a lot of people who wear gloves. So I think if you are wearing gloves out, I suggest wearing a glove on one hand and then having a clean one. The clean one is obviously going to be used to touch your personal items and things that you'll eventually bring into your home. So it's important to always have a free hand wherever you are. I think it's always important to remove them before you get into your car. I think above all, proper hand washing is still the best way to prevent the spread.
I definitely have seen, unfortunately, people utilizing gloves all day through multiple things, driving with them, going to the store with them, casually shopping at Target with them. And I don't think they fully understand that they're supposed to be kind of like one-time use. I kind of wanted that clarification because I personally was like, well, wait, isn't it better then to just, use your own hands and then just wash really well?
Right. Yeah. I feel like your car is kind of your safe place. You're transferring from your house to your car. So I think you would treat your car just as you would treat your house.
These are very unprecedented times, but How do you feel when you find out that people are protesting the protective measures implemented by local governments? Because, throughout the United States and including San Diego, there have been protests. How does this impact you?
Yeah. Dozens of protests did, break out across the country over the last week by those, I think, that are just downplaying the seriousness of the virus. Aside from the protests, I've seen freeways full in the mornings, others barbecuing with friends and family. I'm sure we all have those neighbors that are having parties and people over, especially among the younger generation. And as a nurse, it's so frustrating to see and witness. It's not about me or my coworkers, it's about we. Freedom doesn't mean that we risk injury and death of others just to make a point. My question to people is, why are you being so irresponsible when we're not quite going in the right direction yet? I know that eventually the country will reopen, but we shouldn't do it without a careful strategy in place.
But, my concern is as the weather gets hotter and people start, getting more lax, they're not thinking about the risks that, are inevitably going to affect other people. I did want to ask about the immunocompromised individuals. I feel like, unfortunately, the media doesn't really cover them as much. Just wanted to hear your thoughts on those people because they're not all elderly.
I've cared for patients as young as 19 to as old as patients in their 90s. But for the most part, I think any health conditions or diseases affecting the immune system, which reduce the body's ability to fight off any infection, the impact could be a lot worse. We all know someone who is immunocompromised, has underlying health conditions. I think it's important to take those people into consideration when, wanting to go to the beach.
What is something you'd like the general public to know? I mean, I know that there's a lot of things that go on behind the scenes, but
Yeah.
What is something that you would like the people to know?
I think it's important for the public to know that these seemingly over the top measures of social distancing, cancellations, and limitations in unnecessary contact will make a difference eventually. We may not be able to prevent it from infecting the total number of people it will infect, but if we can spread out that infection rate over time, I think our healthcare system, as far as hospitals, will be better equipped to handle it.
Lastly, how can we help as a community? What can we do as individuals?
I think there are things being done that just really have brought so much warmth to our hearts. You see the clapping at night at 8 p.m. And yeah, I think, everyone in the healthcare industry, just appreciates it. Meal deliveries, mass donations. I think our community has already done so much to show their support during the pandemic. But the other way that's more important than I think everything is to stay home. Nurses are begging, in fact, imploring the public to stay home, slow the spread of the disease, because it's just making the risk posed to nurses and healthcare providers even greater. We're willing to go to work, but we just ask that the public stays home.
Yeah, definitely. Yeah. And then is there any way that we can donate directly to the hospital?
Yeah, both hospitals actually have drives, and they have drive-up tents. So if you are in like the painting industry, auto, I know they have a lot of extra masks and that they're not using now. Yes, if you've got extra protective equipment, both hospitals will gladly take it. And I've got a friend who's donating some gift bags to our nurses tomorrow. I know you and Rachel donated meals, and we really appreciate it. And I think the community as a whole has just kind of kept our unit fed. So.
Well, that's awesome. Well, thank you so much, Ari. I really appreciate you meeting with me and just discussing all this. I think it's definitely something that needs to be shared. So thank you for everything that you're doing.
Of course. My pleasure. I couldn't imagine doing anything else.